I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we are going to talk about how to sit at a computer. This is the number one thing I talk about daily, and everyone always seems surprised when I discuss it with them and I show them how they're supposed to sit at a computer, even though I feel like I've said it a billion times. So it's never a topic that gets old, and people really seem to struggle with how to sit at a computer, and it's the cause of a lot of pain, neck pain, back pain. You know, a lot of people that come in here to get treated, I have a very candid conversation with them saying, if you don't change how you sit at your desk, I can't help you. I can't fix in an hour what you do 23 hours out of the day and destroy. So this is how you're going to set up your computer station for you. Now notice there's no computer station in front of me, and nor is my desk set up to be ergonomically correct. And this is one of the things that I do have to defend quite often, because patients always say, let me see how you sit, let me see your desk. I don't sit down much. During my day, if I sit down for 15 minutes at a clip, that's a long time. And I'm constantly sitting in different chairs on different surfaces. I'm up, I'm talking to people, I'm working on people, I'm sitting with a staff member, I'm sitting in a different chair. So for me, I don't need an ergonomic setup. If you're that exact same way, chances are you're not suffering from any sort of back pain due to how you sit. So that's not really an issue. Now, a lot of times what people do is they underestimate how long they actually sit. And when I listen to their day, and it's always started with, I don't sit very much. But, you know, yesterday, okay, you know, talk me through your normal day. And when you come to find out, you know, an hour of sitting consecutively is a lot. And a lot of times people don't realize how much that adds up during the day, or when you go home and you have dinner and then you sit and you're sitting from 8 at night until 10, 11 o'clock when you finally get up to go to bed, you kind of lose track of that time. So really be aware of when you think, oh, I don't sit that much, or you say, I don't sit that much. Do you really not sit that much? Do you have a reason to be getting up every 15 minutes? If you work in this office, the answer is yes. There's always patients, there's always things to do that involve you being up out of your desk. But if you work at a desk job, if you work in somewhere where it's more sedentary, even though you may be going back and forth to meetings occasionally during the day, for the most part, you are sitting. So really be honest with yourself when you take stock in how you are sitting, because you need to understand how long you do sit during the day. So when you're sitting at your computer, I recommend you actually start with kind of a blank slate. And I mean that by, do not make your posture fit your computer. And this is a lot of the mistakes that I see. And one of my things that I'm infamous for is having a coworker take a picture of you while you're not watching. And I really recommend doing this, because this will give you a really good picture of how you actually sit. When you know someone is watching you, when you know someone is looking at you, you do things that you wouldn't do normally. I have a two-way mirror on my office, because people sometimes think, oh, she's in her office, she's not paying attention. When really I'm sitting there watching you, because I want to see what you're doing when you don't think I'm watching you. It's like my kids, when I come out, they're angels. When I turn my back, all of a sudden they're punching each other and, you know, pointing fingers. So when you want to look at how your posture is during the day, have somebody just randomly take a picture of you when you're not aware of it. And that's a really good way to show yourself, are you sitting correctly, when you kind of zone out and you're in that posture. But when I started this statement, I meant don't fit your posture to your computer. You fit your computer to your posture. So you always want to start with a blank slate. You always want to start with your chair. And you want to sit in your chair, and I'm going to show you sideways, because this, I think, is the best view. And you want to sit in your chair. You want to roll your shoulders up, back, and drop them down, and you want to bring your elbows to 90 degrees and your wrists to neutral, all right? Feet flat on the floor, all right? Your back can be up against the back of the chair. It can be forward. A leg can be dropped. This actually helps pull your pelvis forward so you don't have to sit so upright. The biggest mistake people make is they actually sit too rigid. They sit too upright, and then within 5 minutes, they're like, oh my gosh, my back is killing me. Your back's going to kill you. You're not designed to sit up straight, that straight. You're not designed to maintain this posture. You're not designed to glue your shoulders back and sit there and hold that for 8 hours. Of course you're going to slump, okay? So I always recommend having a leg dropped if that's comfortable. It might not be comfortable for you, but if you're able to tolerate that, dropping a leg and sitting and having your pelvis naturally pulled forward by your leg is so much better than trying to sit here, sit up straighter, or put the backrest exactly where it needs to be. That's a very difficult and challenging process, believe it or not. But what you want to do, shoulders up, back, and drop them down. Notice I said up, back, and drop them down, not up, back, and glue them back, and try and hold this. Again, you're overcorrecting. You're going the wrong direction. You're going to cause yourself pain. So make sure it's up, back, and drop them down. Elbows at 90 degrees, wrists in neutral, not like this. Then you're going to slowly move your way up to your desk without moving this posture. Now you take stock in where everything is. Is your monitor at eye level? Now, a lot of people will answer this and they'll be like, oh yeah, I have to lower my eyes a little bit. Your eyes will follow where your neck will follow where your eyes go. So while you think you can look down like this and you can keep that for 15 minutes, your neck is going to go right along with it. It's just natural. It's what your body does. So wherever your eyes are looking, if you think that, oh, okay, my monitor should be here, but it's really here, and all I have to do is to lower my eyes, but I can maintain that posture, forget about it. Because the minute you don't think about it, you're starting to slide into this slumped position. So you want to make sure that your eyes are at the top of your screen. If you have dualies, get them close together, as close as you possibly can. If you have a laptop, you cannot have proper posture on a laptop. You either have to have a separate keyboard or you have to have a separate monitor. It is impossible to set up a laptop with proper posture. So you're going to have your monitor at eye level, top of the monitor at your eyes, 90-degree wrists, 90-degree elbows, neutral wrists. You don't want to have the keyboard too high or too low. A lot of people, again, will say, okay, I'm just going to bend my elbows a little bit. Well, if you bend your elbows a little bit, you have to lower your wrists. Now we're talking about carpal tunnel, whether we go this way. Now we're talking about different injuries. So it's not a matter of, oh, it's not a big deal, I'll just raise and lower my elbows. Your desk has to be here. Now, whether you have to raise your chair in order for that to happen, which may mean you need to raise your monitor, those things have to occur. But again, make sure you're taking your posture, you're doing it out here and rolling yourself forward to see exactly where you need to be. The biggest culprit of a lot of arm pain, if you got headaches, numbness and tingling down your arm, is a mouse. All right? If you're experiencing any sort of tendonitis in your elbow, hand pain, wrist pain, anything like that, that is caused by improper posture. That's caused by the mouse that goes all the way out here eventually. And then all of a sudden you're like, oh, wait, it shouldn't be here. But how long was it really out there? I don't know. Enough to destroy your muscles. So you want to make sure that you have kind of a boundary for this mouse, whether it be on a little pad next to your keyboard, whether it be just kind of boxed in so you don't wind up with it way out here. Okay, your mouse should be here. This is where everything should be. This is where your world should be. If you wind up on the phone a lot, whether it be your cell phone, whether it be your landline, you need to make sure you have a headset, that you have a Bluetooth, because the last thing you want to be doing is this. The last thing you want to try and do, even though they have those little handheld wonderful things that go on the back now that, you know, you're able to hold your phone in the palm of your hand, you still have to hold your phone, which means you're going to shrug your shoulders up. So if you do any type of phone work, whether it be a physical phone that's there on the desk or whether it be your cell phone, you want to make sure that you have a headset to do so. Everything stays right in here, okay? Regardless of whether you set your desk up correctly or not, regardless of whether you have proper posture or not, you have got to get in the habit of getting up every hour. And I really recommend doing something to get up every hour and do it while you are doing something. So if you are on phone calls at least once an hour, every time the phone rings, stand up. You don't have to take a walk to the water cooler. You don't have to take a break. You literally just stand up and answer the phone. That's going to help keep that blood flow. I don't care who you are. You're not designed to sit for 8 hours a day. There's been a ton of studies. They're saying sitting is the new smoking. You are not designed to sit continuously for 8 hours a day. And we all get sucked in and we all get taken, away from concentrating on posture. Put a pop-up on your screen. Put an alarm on your phone. Do something so that every hour you are at least standing up. Again, it's just to stand up. You don't have to stand here for long. Sit to stand desks are great. The same thing goes when when you go up to a standing desk. If you're here, roll your shoulders up, back, drop them down. Elbows at 90 degrees, wrists in neutral, top of the monitors at the top of your eyes, and here you are. The best thing you can do is get a sit to stand desk so you're not standing all day and you're not sitting all day. But the same posture rules apply, all right? The only thing that you want differently when it comes to standing desk because you don't want to lock your knees out. So you don't want to be standing in this arched position so your butt's sticking out and you're kind of back like this. You want to make sure your knees are a little bent, probably in a wider stance, okay? And sway back and forth. Like you fidget. If you watch me, if you're in the clinic, if you see my videos, you notice I fidget all the time. It allows blood to keep going to the muscles. When you stop and you stand still, it's really hard on your body. So make sure that you are moving. Make sure that there is some sort of movement in your day. This is not going to happen overnight, and it's not going to happen without 100 reminders. It is something that you have to program yourself to do, and it takes time and it takes conscious effort. So don't think that tomorrow you're just going to go into work and be like, Heather said to move every hour, and I'm going to move every hour. You need to make sure that there's alarms. You need to find ways to pattern this into your day so that you're able to, every time the phone rings, stand up. You're able to find something in your day that will trigger you to, okay, I need to stand up. If an alarm works for you, then an alarm works for you. But this is how you keep your back and neck healthy. This is the number one way that you destroy your back and neck, is sitting in improper posture. And again, there's no medicine, there's no injections, there's no surgery in the world that's going to allow you to sit for 8 hours a day continuously. Eventually, it will catch up with you. It may not caught up with you yet. It may not caught up with your neighbor yet, but it's going to catch up to you.